Mental health care in the United States is one of the most poorly diagnosed and treated disease states, thus creating a system of high costs that is carried by the United States taxpayer. Hi, my name is Cameron McMillan. I would like to take a few minutes of your time to talk a little bit about this topic and a possible solution. Nothing is free, and mental health treatment is no exception. A mental illness is not a broken bone or a torn ligament. As a matter of fact, mental illness is more devastating and can take much longer to heal. Mental illnesses cannot be treated or healed with surgery, a cast, or even physical therapy. The cost behind the treatment is definitely a scary sight for those with low income or without adequate insurance. According to National Alliance on Mental Illness, approximately 1 in 5 adults in the United States, or 18.5%, experience a mental illness in a given year. This shows you just how serious and how widespread this issue is. Now, the amount spent on medical disorders is astronomical. Lindsay Holmes from Huffington Post found that in the United States spent an estimated $201 billion on mental disorders like anxiety and depression. In case these stats didn't get your attention, here are some that I know will. About 50.6% of children with a mental health condition aged 8 to 15 received mental health services in the previous year. More than 90% of children who died by suicide have a mental health condition. These were also found by the National Alliance on Mental Illness. Tim Flanagan states that between 2009 and 2010, states cut $5 billion in mental health services and eliminated over 4,000 public psychiatric hospital beds, which is nearly 10% of the entire supply in the country. In this new reality, too often people suffering from mental health disorders don't receive the care they desperately need. Although this is ultimately reduced, the cost burden to the United States taxpayer is only increases the cost of untreated mental health care to patients. In addition, Flanagan explains, many who need care end up in county jails, city streets, and emergency rooms. He says the reasons for why they end up in these situations is because states looking to save money are neglecting community and mental health services put in place to keep people healthy. The question might be asked, why are these numbers the way they are? And the answer I've chosen to focus on is cost. Many families simply can't afford to have care provided to a loved one. There are programs out there that help these situations, like Medicare and Medicaid. Medicare provides health coverage to around 57 million people who are over the age of 65 or have disabilities. Nearly $594 billion went into the Medicare from taxpayers, according to Center on Budget and Policy Priorities. While Medicaid, a program working taxpayers pay into, provides health care for people who can't or don't work or are underprivileged. Until a solution is found for the young and poor with mental health issues, Medicaid costs will go up. In addition, those elderly that qualify for Medicare and who also have mental conditions will also drive up the cost of care. This will solely rest on the shoulders of the United States taxpayer. Diagnosing early and accurately and treating early and accurately could potentially have an impact on significantly decreasing the cost of mental health care. In order to reach this goal, a stronger mental health care program must be developed within the Medicare and Medicaid programs. This more robust program will deliver an earlier and accurate diagnosis in addition to an earlier and accurate treatment. The cost to build a more robust program will be minor compared to the results that it will deliver and the reduction in cost of care. According to Tim Flanagan from Healthcare Recruiters International, About 80% of individuals with depression will recover fully with appropriate diagnosis, treatment, and monitoring. If depression can be reduced by 80% due to early and accurate diagnosis and treatment, just imagine the impact on reduction of cost of care for the various mental health conditions. As I've previously stated, the magnitude of the cost of mental health care in the United States is staggering. There will continue to be many ideas and potential solutions to reduce the cost of care, some of which, for example, are the closure of mental health clinics, hospitals, and the elimination of caregivers, all of which, in my opinion, delay and increase the cost of care by reducing the access and treatment of this devastating disease state. As stated earlier, in my opinion, building more robust treatments of care may in the short term increase cost, but long term will ultimately increase early and accurate diagnosis, as well as early and accurate treatment of care, ultimately reducing the cost impact to Medicare and Medicaid and the burden carried by the United States taxpayer. After discussing the cost of mental health treatment, key debates include why mental health treatment is so expensive, whether or not the cost should be reduced, and what the consequences of the high costs of mental health treatment are. Should we assume year over year costs increasing and no clear plan to control them, that these increases will continue at the same percentage rates or higher? The nation's largest population, all turning 65 and qualifying for Medicare, it appears these costs have no intent of slowing down.